I think we have this possibility of integrating cultures, and we are open. We used to hear from the spirits that they had chosen Brazil as the country. They say that Brazil is the country of love, of open-minded, and the perfect country to develop this kind of philosophy and religion and science that is the Spiritism. We have in Brazil many Spiritist hospitals, psychiatric hospitals, because in many times we observe that this kind of phenomenon and symptoms, they come from a communication, an open possibility, the mediunity, and the possibility to communicate to the spirits. And in many cases, we are just dealing with obsession. Of course, we know that in other cases, we have real delirium, real hallucinations, and we should do this difference and this diagnosis, the right diagnosis. Even if the person is becoming really with psychosis, and sometimes they have the illness, but they have also the influence of these communications, of the influence of this presence of the spirits. You know, like if you are dealing with addiction, with chemistry dependence, we know that many times you are also observing that these persons, they had also a strong influence from the spirits, a strong influence from bad energies. As you can say, you can see someone who drinks a lot, and he could drink a whole day, a whole night. In some case, this person did not get drunk. It's interesting. We used to hear from the spirits that in these cases there are kind of obsession. The spirits that persons who died with this kind of illness, with the addiction of alcohol, and then he died, but he still have a body, a astral body. He still needs the alcohol, and he could come close to this person, incarnated person, and take off some of the energy of the alcohol for himself to respond to this to his addiction. So in these hospitals like this, we do a lot of work with this obsession. The first thing is the diagnosis and the consultation with a physician, a psychiatric. And then this psychiatric, he could be a spiritist person or not. But it has to be a psychiatric, and this doctor will attend this person and will make his diagnosis. And of course, this person will also have an attention from a psychologist and other therapists, and they will also give a diagnosis. And then he begin his treatment here. It could be a recovering treatment, but it could also be a day clinic, a hospital day, and also the ambulatorium, just the office. And all of these opportunities, this person, if he wants to, he will receive also a spiritual diagnosis. And in this case, we will see, is there an obsession? Is it grave? Is it a great, important obsession? Is it an self-obsession too that happened sometime, that you were confused with your parts, like you see from the psychosynthesis, Roberto Assagioli, this very known psychiatrist from Italy, and he used to say that we have sub-personalities, small I's, that are acting and disturbing sometimes our personality. So we will do all this diagnosis, and then this person will receive both healings, both treatments, the psychiatric one with all the role of other therapies, and also the spiritist healing. All the people, all the patients, now we have at about 250 patients here, 100 in chemistry dependence, in a department separate, of course, and the other ones with illness, mental illness, schizophrenia, bipolar, and depression. We have a lot of patients with depression, and all the patients will receive the spiritist treatment, the prayers, and the fluidic magnetized water, and also the passes, magnetic passes. All of them will receive.
E pede a Deus para que essa água seja transformada. Daqui vão fluidos da nossa aura, fluidos nossos, e fluido dos espíritos. É uma conjugação de fluidos.
Of course, if someone says, this is not my religion, and I don't want to receive that, he won't receive personally. But of course, he receives like the whole spiritual treatment for all the patients, and also the families. The families can come. They used to come in the night. We have here in this Casa de Eurípides, we have about 300 voluntary mediums working here without asking any pay for that. And we have several groups. Some groups are specialized in some illness, like chemistry dependence or depression, and all the groups act during the whole week doing this spiritist healing. We have once a week, we have a meeting with all the therapists of Casa de Eurípides, and we discuss the cases. And so we discuss with everybody, and even if that psychiatric, even if he or she is not a spiritist, he knows that our pattern of our program here is a program of using less medicines, and to have the spiritist healing for everyone. And of course, if the patient is in a crisis and needs that medicine, he will have it and he will take it. But we discuss a lot with all the physicians we have here and the psychologists, and we say, here is a spiritist house, a spiritist hospital. And we believe that the patients will have a good result if they have less medicines and if they have the Spiritist treatment together. But we also use the best ones we have in the market. Of course, if the patient come from an insurance, of course sometimes you have to make an adaptation. About 75% of our patients come from the government insurance. So the people, they don't have to pay for this. The government, with our national plan, SUS, or National Health Insurance for everybody, they can have this treatment without paying for it. So that's also very interesting and different, I know, from the United States and other countries. We don't ask for any payment for the Spiritist healing, not at all. All these mediums, they work as voluntaries. They don't ask for money. They should not ask for. That's the principle of our religion. We are not a hospital that looks for the economic result. And even the direction of the hospital, they don't ask for any pay to be here. They work as voluntaries. Of course, the physicians and the therapists, they had paid salary, like me. I have the payment for my work as a physician, a psychiatric, but I also do a lot of Spiritist work here in the evening and in other times, and I don't ask any money for that. Bipolar or a psychosis without control, perhaps he'll need more than 2-3 months, perhaps, and also and after this recovering time, perhaps he will need to stay here close to the hospital in Goiânia, to come back just to have the attention from the physicians. And if it's chemistry dependence, we are treating many patients with cocaine dependence and also alcohol and crack. We have, unfortunately, most of them here comes from this addiction, this terrible addiction of the crack. So in these cases, they stay here for 1 month, but they could stay longer if he needs. And of course, we work as a net, a great net. When he comes, when he is recovered and he comes out from the hospital, he should go to other places to continue this work. But I can say that one could come from, we have been patients here from other countries even, and normally they stay here for 2 or 3 months. It's good enough to have all the treatment and all the Spiritist treatment. We have already some research about it, not really in our house. We should begin to have them, but in other Spiritist centers in São Paulo, they have some research. But the people look for Casa de Eurípides, for this hospital, as they used to say, is the best hospital to be. And when someone asks for the government to come here, he has to go to this emergency unit, and then when he gets there, there's a long line to come to Casa de Eurípides, to this hospital. He had to wait. Sometimes he has to wait a long time. And so when the people from this unit, they used to say to us, oh, everyone wants to go to Casa de Eurípides. And we know, of course, they are looking for the results. So, and also when you have a very grave case in other parts of in other departments and other clinics in the city, and they used to say, oh, this is a case for Casa de Eurípides. It seems like it's also a spiritual problem, and they ask us to receive this person. We have a lot of problems because we need much more money. You know, it's we do real miracles to maintain all of this. What the government pays us is very little. It's not enough. So what we are receiving is too little to maintain a hospital like this. We have almost 180 professionals. We have a very good restaurant, refectorium. Our food is very good. They like it very much, and of course, this spends money. It's too expensive to have all this here. We are also known as a hospital who does humanized work. You know, we ask for all the professionals that work here. We used to say you should have your heart open. You should work with love. You should be careful to take care of these patients. And this makes a big difference too. And we also have music therapy, art therapy, so that makes also a difference. We are a different hospital, as you can see, a lot of nature, and the patients like to be here. They feel comfortable here. When the families came, and the families can come many times a week. You know, we have meetings with the family. We have family therapy. So I think it's all together. It's not just this obsession work, but this obsession work is our most known and I think important healing for this kind of patients. Principal reasons we are observing this so big improve of the Spiritism in Brazil and the Spiritist healing, so many people looking for it. I think we have three main things. First of all, the results itself, of course. If the person comes with a lot of sufferance and then he can have a relief of his sufferance, that is it's a good reason that he would like to come back and to ask two other persons to come. The other thing is the humanistic approach. This is very important for us, the humanistic approach. And the other thing is no profit asked. You know, we don't ask for any profit about that, all as voluntaries, you know, so I think this is very important too.